Welcome to PedsDocTalk TV. I am Dr. Mona Amin, a board-certified pediatrician and mom. And on this video, I am going over diaper rashes. Why do they happen? How can you prevent them from happening? How to treat them? And when to see a clinician. This video is brought to you by the New Mom Survival Guide, an online digital e-course and community created by me to help moms through their first year of motherhood, with modules on baby hygiene, newborn sleep, newborn care, introduction of solids, development, infant sleep, and teething, and so much more. I guide you through that first year of motherhood so you feel supported, educated, and empowered. By purchasing the course, you also get access to a private Facebook group where we have monthly Q&As based on various topics. Before we continue, make sure you hit that subscribe button because that's how you stay up to date on all of the videos I'll put out here on PedsDocTalk TV. And here we go. So why do diaper rashes happen, and why do they seem to happen more for newborns? A few reasons. One, the newborn and infant skin, especially in the diaper region, is very sensitive. And when you add on something like poop and urine, the chemicals in poop and urine can cause irritation to the skin. And you trap that all in a diaper, and there can be increased moisture, which leads to increased irritation and increased chance of a rash. Now, you can be on top of diaper changes all the time, and some babies are just more prone to diaper rashes. In this video, I'll go over, in these situations, what you can do, but also how you can prevent them from happening in the first place. But rest assured that even if you do all of these tips and you still do see a diaper rash, I will also go over how to manage it and when it's time to say, hey, we need to see my baby's clinician to get it taken care of. The best way to prevent diaper rashes, remember what I said, that sometimes you could do all this and rashes still happen because their skin is sensitive. The best way is to do frequent diaper changes and use particular ointments or barrier creams with every diaper change. You're going to find that newborns tend to have a propensity to develop diaper rashes more so than an older infant or a toddler. And this has to do with, one, their skin is way more sensitive, and number two, they are pooping and peeing more frequently. So that means more irritation, more moisture, and more chance of developing a rash. I know if you're watching this and you're expecting a baby, or maybe you have a baby who is a newborn or in that infancy stage, you're probably telling yourself, I feel like I'm constantly changing diapers. I promise you that it does get better. Obviously, as they get more control over their bowel habits and as they just get older, they are not going to be pooping and peeing as much. So initially, you're going to feel like you're changing the diaper every 10 to 12 times a day. And this is very common in those initial months when you have a newborn. If your baby is sleeping, remember that you do not have to wake them up to change a diaper. Now, if your child is prone to getting really severe diaper rashes, your child's clinician may recommend that. But for the general baby, we do not need you to wake them up to do anything, including diaper changes. But if they do get up, you're going to change their diaper first. And that can wake them up a little bit for a feeding. And then you feed them. If they have a bowel movement or urine after a feeding session, you're going to change it again. But you're going to find that initially, especially in that newborn period, you're going to be doing a lot of changes. But remember, if they are sleeping, you do not need to wake them up to change the diaper. Diapers are absorbent for a reason. So if they're not bothered by it, don't wake up a sleeping baby. When cleaning, make sure to not scrub and rub the genital area. Like I said, it's very sensitive. So you want to open up their legs, and when you clean, you go front to back. If you have a little girl, you can spread the labia and just go front and back to clean up any poop or urine that could have gotten into the labial folds. Remember not to take the wipe in an up and down vigorous motion because that can irritate the diaper region even more. It's also important that you're generous with the ointments that you're using with diaper changes. So you don't want to just use like a little bit. You want to make it a nice frosted layer, whether that's an ointment like a barrier cream or something like zinc oxide. And I'm going to get into the differences between these ointments. So when you're looking at diaper rash ointments over the counter, you have two kinds. You have barrier creams, and then you have ointments that have zinc oxide in it. Barrier creams are things like Aquifer Healing Ointment or Vaseline. They usually contain things like petroleum or basically just very simple ingredients, and they don't contain zinc oxide. On the other hand, you have ointments that have zinc oxide in it. These are things like Bordeaux's butt paste, triple paste, Aquaphor Fast Relief diaper rash paste. These are things that contain zinc oxide. Now, for routine diaper changes, you can use a barrier cream like Aquifer Healing Ointment, Vaseline, or an equivalent that you found. This will help protect the skin from moisture from urine and poop. These ointments don't contain zinc oxide, which is that white mineral substance that you've probably gotten familiar with, but they do serve as a barrier protection, and they're great for everyday use and multiple times a day. If you notice any redness at all to the skin, like you're noticing a hint of redness, this could be the sign of a contact rash that's starting, an irritation. So at this point, you want to use something like a zinc oxide ointment. Like I mentioned, these are things like Bordeaux's Bud Paste. These are things like Aquaphor Fast Relief Diaper Rash Paste or Triple Paste. Remember that this video is not sponsored by any of these companies that I'm talking about. I just want to give you some examples so you know when you're going to the store what each of these are and why they may be useful. So zinc oxide is really great when you start to see the presence of a rash. Zinc oxide is a component found in many skincare products, including for people with acne, but especially for babies and diaper rashes. Zinc oxide helps to restore the damaged skin that you may see in a diaper rash, but also helps protect like a skin barrier or barrier protection like Vaseline or Aquaphor or something like that. Now, you can use zinc oxide ointments with every diaper change if you want, but it's a little messy because it's white and it can get a little bit goopy. And also it can be more expensive. That's why when my son was a baby, we stuck to things like Aquaphor Healing Ointment for routine diaper changes. And when I started to notice a redness, we would switch to a zinc oxide ointment. We ended up using Triple Paste or the Aquaphor Fast Relief Diaper Rash Paste. So you can use the zinc oxide ointment if you want on a regular basis. But I find that using a barrier cream can suffice, and then switching it up to the zinc oxide containing ointments when you start to notice the sign of a little redness. Now, there are a lot of old school remedies for diaper rashes, which I'm sure grandma's telling you, hey, use this. We used it for you and it worked out great. Now, these things are not recommended. So the first thing is cornstarch. So cornstarch is an old school remedy, cornstarch that you probably have in your kitchen. And the reason we do not recommend that, one is that if the baby inhales it accidentally, because it's, a powder substance in that diaper area, it can lead to a pneumonia or pneumonitis, an inflammation in the lung. The risk is low, but we don't want that if there are other good options like barrier creams or zinc oxide ointments. Also, cornstarch can be a breeding ground of yeast, and we don't want to cause more problems or a yeast infection when that's what we're trying to avoid. Another issue is talcum powder. So talcum powder is also an old school remedy, which we do not recommend anymore. This can also cause a risk of inhalation injury. And when used on broken skin, it has been shown to cause infection. And remember, when your child has a diaper rash, there may be irritated or broken skin. So we want to stay away from both cornstarch or talcum powder. Think of it like this. Even if generations have used this, if there is a safety concern and we have other great options like barrier creams or zinc oxide creams, why not use those to avoid any risk? So one of the biggest things that parents, I think, get confused about is that not all diaper rashes are treated the same. There are different reasons that we can develop a diaper rash. Some may be yeast related, some may be bacterial, and some may just be from contact. So first, let's talk about the most common one, which is a contact dermatitis or a contact rash. Contact from what? What are they getting in contact with? Urine and poop. Remember what I said, that urine and poop in a trapped diaper with moisture building and also with no air circulation can cause irritation to the skin. So this is going to look like a rash that's flat to the skin. It can look shiny or it can just look red and irritated. You're not going to notice satellite spots. It's all just going to be flat and even. You're not going to notice that it's raised off the skin. If you notice this, you want to continue using your zinc oxide ointments like I mentioned. And you also want to make sure you do frequent diaper changes so that you can avoid this becoming something like a yeast or a bacterial infection in the diaper area. Now, from my own experience, sometimes these contact rashes can snowball very quickly, not only for my own son when he was an infant, but also for patients. I'll have a patient say that, look, I woke up this morning and I noticed this little rash, and now I just feel like it's snowballed. That can seem to happen, which is why I want you to know the difference. Now, if you are treating a contact rash, but you're starting to notice that there's spotty areas, look at this picture where it just looks like areas that are different locations, some areas that are clear around areas of redness that looked raised off the skin, this could be a sign of a yeast rash. Remember that yeast lives on our skin, on my skin, on your skin, and on baby's skin. But when you add in the moisture-filled area of a diaper and poop and urine, it can cause the yeast to overproduce in this area. It's very common in newborns and in infants. So if you start to notice that it's raised off the skin, we say that you can almost peel it off like a beef slab, like you can peel off a layer of that skin. You're not going to, but it looks like there's texture to it that you can lift it off. There's a concern there that this may be yeast. Remember that you're not lifting it off, but it looks as if it's raised off the skin and not flat. This can differentiate from that contact rash to a yeast rash. If you see a yeast rash, you're going to want to continue doing frequent diaper rash changes. You can use over-the-counter regimens like clotrimazole. Clotrimazole is a over-the-counter antifungal ointment. But in some moderate to severe cases, you're going to need to see your child's clinician, and they may need to prescribe you something called nystatin. Nystatin is a prescription-level antifungal. If you use these, you're going to be prescribed it, and you're going to use it 4 times a day for the nystatin until you see that rash improve completely. When you see it go away, meaning they're back to their normal skin, then you're going to stop it 2 days after. Same thing if you end up using an over-the-counter remedy like clotrimazole. If you're using clotrimazole, you're going to do that twice a day, and then you're going to stop it 2 days after complete improvement. The reason why I want you to clear the type of rash with your child's clinician is that yeast looks very different than a contact rash. I don't want you to overuse antifungals when it's not a fungal rash. Sometimes I see parents get a prescription for nystatin, which is an antifungal, and they start using it for every diaper rash that they see. But remember, not all diaper rashes are fungal. Not all diaper rashes are contact. So it's important to be able to differentiate it. When it's your baby and you've gone through a lot of diaper rashes, you're going to get the hang of, well, what do I need to do? In some situations, I want you to see your child's clinician because they may also recommend a steroid, a low-dose steroid that they put on this area if it's looking very inflamed. This can be if it's fungal, but this can also be if it's a contact rash. So if this is the first time you're ever seeing a diaper rash and you are using your zinc oxide creams and it's not working, I would highly suggest just running this by your child's clinician in an in-office or telemedicine appointment. I find that in-office is better just because we can see the texture and really get a better look than what a video would do. But that's up to you and your accessibility to your child's clinician. Now, the last one is a bacterial rash. Now, this can happen and snowball after a contact rash, and you're going to notice sores. There's going to be open wounds or even sometimes pus. If this is happening, I do want you to run it by your child's clinician. They're probably going to say, hey, keep it open as much as possible, continue using your zinc oxide ointments, but they may also add on antibacterial ointment. A common one that we use is something called mupirocin. Mupirocin is a topical safe antibiotic ointment if we see that it's developing sores and pus. Now, this is something you're going to want to monitor closely because if it's getting worse, if you feel like it's spreading, we're going to want to evaluate to make sure we don't need to change anything in the regimen or add on anything else. So here are some other tips. Now, what I mentioned already is good for the general baby that gets these kind of infrequent diaper rashes, right? You make sure you do frequent changes. If they're sleeping uncomfortable, you don't have to wake them up. You use your barrier creams, and then you can use zinc oxide ointments if you're noticing the first sign of redness, which is why it's so key to do diaper changes in good lighting if we can do that. You may not be able to do that during the night because we don't want to startle them awake and get them more awake than they need to be. But definitely in the morning and throughout the day, try to make it where you can see the diaper region well. Like I said, that these things can snowball. So if you can get on top of it earlier, you may prevent it from snowballing into a yeast or bacterial rash. But here are some other tips that you can do if your child is more prone to getting diaper rashes and you're so frustrated and you've tried all the ointments. Think about the following. So your child may just have really sensitive skin. So any scrubbing or rubbing, like I said, is not recommended, but you may have to wipe, and even wiping can be an issue. An option I have for some of my families is taking a blow dryer and on a cool setting, using that to fan off any moisture. So rather than using a wipe, you're going to use that to wick away any moisture that's there. You can also use a squirt bottle with water so that you're not doing as much scrubbing and rubbing of poop or urine that may be on the skin. Other things that you can do is keep your baby out of a diaper if it's a really significant rash or they're prone to them. Remember, air really helps. So using a blow dryer on a cool setting is a great tip, but also just letting it air out can really provide that healing that they may need to prevent that red rash from developing further. Remember that this happens because of moisture trapped in a diaper. So if we can cause more air and expose the bum to air, It can help prevent it from snowballing. If your child is prone to diaper rashes, you may need to trial different ointments. So just because your friend is using an ointment that's really working for their baby, go ahead and try it, get a little sample or maybe borrow some from them, like in a little jar, see if it works, but you may need to trial different things. Remember, with baby skincare, every baby is unique. Every adult is unique with our own skincare. So it's not always a one size fits all. So it's really about trying to find the best ointment that works for your baby. In some situations, you may need to change the diaper. Sometimes cloth diapers may help more, and sometimes it may be that if you're using disposable diapers, you have to change the brand. Again, your friend could be using one brand and it works great, but you may need to switch another common drugstore brand that is out there that may work better for your baby. There are diapers that are marketed as more sensitive. Worth a try, but remember, buy the smallest pack, maybe even a sample size, before you buy the whole box, because we want to see what works best for your child. Now, if your baby is prone to diaper rashes, remember what I said earlier, that you don't have to wake them up for sleep. But if you are dealing with a child who's just more prone, you may need to wake them up while they're dealing with a diaper rash to just quickly change the diaper. Now, remember, you don't have to turn on the light really bright. I don't want them to get fully awake, but you may need to do this, use the proper ointments, switch around the diapers, just so that we can prevent it from snowballing. For other tips on diapering, not even just about diaper rashes, but just how to change a diaper and little tips that I have so you don't have major blowouts, make sure you download my free PDF available here and also in my show notes, because this can really help when you're dealing with diaper changes and if you are a new parent. And for more information on baby hygiene, not only about diaper changes, but about washing your baby, giving them a bath, cutting their nails, and so much more, and modules on so much content in that first year of life, make sure you visit PedsDocTalk.com to get access to the new Mom Survival Guide, which will help you immensely through baby's first year. Thank you for tuning in today. If you have any questions, make sure you comment below, subscribe to this channel to stay up to date on further content. And if you have any suggestions on topic, also respond in the comments section so I can create videos for this community. Thank you, and I'll see you next time.